Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
According to the Centers for Disease Control and Prevention, 38 million Americans are diagnosed with diabetes. That's quite a large number. So in today's show, we're going to address this. We're going to learn some tips and tricks on how to treat and manage diabetes, as well as recognizing the different types of diabetes. And as always, we're going to answer your healthcare-related questions here on this episode of Ask the Doc. No appointment needed. Hi, and welcome to Ask the Doc, No Appointment Needed, the show where we answer your healthcare-related questions. My name is Dr. Kamaljit Kaur, and I'm a double board-certified primary care physician here in South Florida. So let's get right to it. Our first question comes to us from Zaylee, and Zaylee has emailed us this question asking, my mom has had diabetes for many years, and lately it has really been taking a toll on her body. What exactly is diabetes, and how does it affect the body? Sally, this is a wonderful question, and I think it's most appropriate for our first question of the day because we get to go into a little bit about what diabetes is. So let's start by showing you a video that best describes and helps to depict what diabetes is and what happens in your body when someone has diabetes. So basically, diabetes is a state of over glucose or high glucose in the body. When you eat foods or drink something healthy, hopefully, all that food goes down into your stomach and is metabolized by a variety of mechanisms to take out the glucose and turn it into energy for good things to happen in your body in different parts of the body. Now, your pancreas is primarily responsible for creating insulin, the hormone that regulates your sugar. And what happens in diabetes is the glucose that's running through your bloodstream, unfortunately, doesn't get metabolized by that insulin. It doesn't go into the cells that it needs to go into, and it overaccumulates in different parts of the body. This can happen because maybe your body's not making enough insulin. For one reason or another, the pancreas might not be doing its job. Or the pancreas is doing its job, but for some other reasons, your body is not reacting and treating insulin the way it should be. Insulin is not able to do its job. So what happens? All that glucose stays in the bloodstream and it goes to different parts of your body and wreaks havoc. Most notably, what happens in diabetes is the complications. Now, when you have diabetes, whether it's because you have type 1, where you're not producing enough insulin, or type 2, where you're insulin resistant, the results can sometimes be the same with all this sugar just running around in the body. Now, did you know that having excess sugar in the body can affect your nerves? It can cause nerve damage. It can also cause damage to your arteries, your blood vessels, and your heart, your kidneys, your brain, your eyes even. It is the leading cause of blindness even. So having diabetes is one thing, but knowing what it is really empowers you to know how to treat it the best that you can. I think that with diabetes being so prevalent nowadays, it's important for us all to be aware of it and to see what we can do to really prevent it, especially if we have a lot of risk factors for it. Let's get to our next question. This one comes from Olivia, and Olivia has emailed us asking, after my annual physical, my doctor told me I have prediabetes. Does that mean I will be diagnosed with diabetes soon? Are there any risk factors I need to be aware of? I'm really nervous. I think it is very appropriate for you to be nervous, not to be scared, but that makes you a little vigilant as to what should I do to prevent this? Because as you mentioned, there are several other risk factors that create the environment for developing diabetes, aside from the fact that you're pre-diabetic. So let's get into these risk factors a little bit. One of them is being overweight. Excess weight, excess adipose tissue can definitely contribute to the development of diabetes. Being 45 years or older is also an actual risk factor. Having a first-degree relative, so like a parent, a brother, a sister who's had diabetes or who has diabetes can also increase your risk factor of developing diabetes. If you're physically active less than 3 times a week, or you rarely engage in regular exercise, can also pose a risk for developing diabetes. And for women, especially women who are of childbearing age or who are pregnant, having gestational diabetes or having had gestational diabetes can also increase your risk of developing diabetes even after your pregnancy. The other risk factor that sometimes we tend to forget about is if we are of a certain ethnicity. For a lot of reasons, including genetics, patients who are of African American descent, Hispanic descent, or American Indian descent have been found to be at a higher risk for developing diabetes, even if they're not pre diabetic. So that's something definitely to note. Now, while there are many, many more risk factors to be aware of, like cigarette smoking, drinking alcohol on a regular basis, and eating unhealthy, I want to reassure you that being diagnosed with prediabetes doesn't mean that you're for sure going to develop diabetes itself. There's so much that you can do to help prevent this, even if you have all the risk factors that I just mentioned. Eating healthy, exercising regularly, and reducing your stress can definitely contribute to lowering that risk of going into diabetes. All right, let's get to our next question. And this one comes from Barb. And Barb has reached out to us through Facebook. Thank you, Barb. She asks, my husband was recently diagnosed with diabetes, and I want to be able to help him test his blood sugar. Can you explain how to use the meter so I can help him monitor it? Since I'm afraid he won't be able to do it himself. Barb, it's so wonderful that you are there to support him through this and to be his shoulder to lean on at this time. Because even though there's a lot a diabetic patient can do on their own, it always helps when there's a partner or when there's support to do it. And it really helps to stay healthy. So that being said, now there are different types of monitors that you can use. And there's different types of monitoring devices that will give you information in different ways. So all that being said, point is, if you have a glucose monitor, generally these are portable monitors and they require obtaining a small prick of blood from usually your fingertip to analyze and to give you a number. And that number generally is what the level of glucose in your body is at that time. Now it tells you what that level is at that time, not what it was 5 minutes ago or what it's going to be 5 minutes ago. So always take that number with a little bit of a grain of salt. But again, that's something you do definitely want to talk to your doctor about as far as what your ideal number should look like. Now, the monitors generally that are available at local grocery stores or pharmacies are portable glucose monitors, and they usually require test strips, lancets. These devices are needed in order to obtain the blood from your finger and then to put it into the machine so that it can analyze it. Once the machine analyzes your blood glucose and it tells you the number, you want to make sure that you log it. So if you're doing it twice a day, say after breakfast, after dinner, you want to create a table and you want to write down those numbers at least for a couple weeks so you can share that with your doctor, and your doctor can help determine if you're controlled or if you're uncontrolled and we need to fix your medications or do other things to really optimize your diabetic control. The other thing is, how many times a day should you check your blood sugar? And this really depends on the severity of your diabetes, what kind of medications you're on, and how healthy you are overall. For instance, do you have other diseases that may worsen the diabetes and we need to keep a closer eye on the diabetes because of it? As you can see, it's very personalized, so definitely sit down with your doctor, go over all the details, and once in a while, bring in that glucose monitor to your doctor's office so that they can see how you test yourself or your husband, so we know that you're doing it the correct way and you're staying healthy that way too. Our next question comes to us from Leonard, and Leonard asks, I'm a Black man who is 42 years old. My mom, dad, and sister all have diabetes, and I'm told my grandmother's passed away due to complications from diabetes. I go to the doctor every year, but is there anything else I can do to help prevent diabetes? Thank you for your question, Leonard. I love that you're being proactive here. Knowledge is power, and in your case, knowledge is prevention. Since you have a few risk factors already that may increase your chances of developing diabetes, it's even more important that you know what you can do to help prevent that. going to the doctor and getting your annual exam is certainly one of the most important things to do so you know where your numbers are and how close or far away from being diabetic you are. That's really what counts. But what about the rest of the year? We can't ignore that. What are you doing on your own to help prevent diabetes, right? I think that may even be more important than the annual physical exam. So let's go through some of these things that you can do. You can regularly exercise at least 3 to 5 times a week for at least 30 minutes a session of getting really moderate intensity exercise. And when I say moderate intensity, that can be different for everybody, but essentially you want to get up to a pace, whether you're on a treadmill or you're doing squats or you're on an elliptical. You want to get up to the level where you're doing the activity and you can talk, but you can't necessarily sing. I know that sounds odd because who sings while they're on a treadmill, right? I mean, you never know. But if you're on the treadmill or doing any other kind of exercise and you find yourself being able to belt out a tune, know that you might need to do a little bit more in order to get to that moderate intensity level. Now, that's just a general rule of thumb because where you should actually be as far as the fat burning zone and all that stuff, it's a very individualized set of data that needs to be analyzed to give you that answer. So this is just a general rule of thumb, but exercising regularly can definitely help prevent diabetes. Eating healthy. Now, we all know that eating healthy is good for so many reasons, right? But especially inflammation. You want to avoid any foods that are inflammatory because that's going to contribute to the development of diabetes. Now, if you remember a little earlier, I said that all that extra glucose in your body can lead to inflammation. So if on top of it, you're eating inflammatory foods, that's kind of salt on the wound and it's going to make things inside the body worse. Sleep. A lot of people underestimate the power of sleep, but you need sleep because it helps to regulate hormones. And remember, insulin is essentially a hormone. So you want to help optimize it as much as you can, and getting sleep is a good way to do that. You can also avoid excess intake of alcohol, avoid intake of drugs, and avoid smoking. These are all things that can be detrimental to the mechanisms that metabolize glucose and use it for good energy. So you want to try to avoid that. And then managing stress levels. For a variety of reasons, excess stress can lead to inflammation in the body, and then that can promote the environment that causes development of diabetes. Additionally, you want to contact and consult with your primary care physician because, as I said, you want to know where your numbers are and exactly what you personally can do to help prevent diabetes and really mitigate that risk. All right, let's get to our next question. This one comes to us from Nelson, and he reaches out from Facebook, writing, I'm a borderline diabetic, and my doctor was talking about insulin at my last appointment. I have a question. Is insulin the only treatment that manages diabetes? Or are there other things I can do short of taking insulin? That's a great question. Now, times have changed. We have a lot more medication now than we did, say, 40, 50 years ago. In those days, when someone was diagnosed with diabetes, it was generally known that, okay, they're going to be started on insulin. And even though we've advanced so much since then, I think that stigma is still there. And a lot of people still think that when they're diagnosed with diabetes, insulin and injecting it, those kind of things are still in play. And that can be scary. I completely understand that. Now, generally, individuals who are pre-diabetic or borderline diabetic really may not even require any treatment at all, depending on how healthy they are otherwise. And these are guidelines that we look at that are put forth from the American Diabetic Association and the American Heart Association. However, for those individuals that do require treatment, there's a variety of options out there. Again, always individualized to your personal health and what other conditions you may or may not have. So, for instance, oral medications. Now, I know the injections scare a lot of people, and that's the stigma around insulin, but we do have oral medications that help. For instance, metformin. Many people have heard of metformin, and it is, believe it or not, still recommended to be the initial therapy for majority of diabetics. It works well. It has proven to reduce your risk of not only progressing the diabetes and getting to its complications, but also any heart disease, heart attacks, and strokes that are related to diabetes. Then we have a class of medications known as the SGL2 inhibitors. Fancy word, but basically these inhibit certain receptors in the body that help promote the mechanisms behind insulin and glucose metabolism. Some of these are better known as Farxiga and Jardiance. Then we have a class called sulfonylureas, and these are also really good at helping manage the diabetes with the glucose and insulin imbalance. Some of these are known as glipizide or glimepiride. We have another class called DPP4 inhibitors like sitagliptin. Then there's the really famous GLP-1A agonist that everybody knows nowadays by semaglutide, liraglutide. Those are also potential candidates for treatment of and management of diabetes. Now that's about medications, but you asked what are things that you can do to help mitigate your risk, and I want to take your attention back to those lifestyle measures that I was talking about. So eating healthy, exercising regularly, sleeping enough and adequately, and really reducing your stress levels. These factors have been shown to not only manage diabetes and improve your glucose and insulin metabolism, but also sometimes even reversing diabetes. So it's very important that you follow those recommendations too and personalize them to you and your lifestyle. Let's get to our next question, which comes to us from Anna. And Anna has reached out to us through Instagram saying, I've heard that diabetes can actually be reversed. How does that happen? Oh, this is a great question. And honestly, it's the topic of a lot of debate in medical societies. There's a lot of controversy on whether or not diabetes can truly be reversed. There are some medical experts that argue, and studies have shown that diabetes, once an individual has it and they've gotten to that level of insulin resistance, even though it can be properly managed, it cannot be completely reversed or cured. Now we're having newer studies saying otherwise and saying, hey, we can actually reverse diabetes and get rid of its effects totally in the body. And you know what? Honestly, I've actually helped some of my patients reverse their diabetes. So there's one thing for what the medical experts say and what the studies show, and then there's one thing for what patients actually go through in their day-to-day life. And it's important to note that generally, medications, even though they're wonderful and they're there to help us treat and manage diabetes, are not working to reverse diabetes. They're just working to keep it at bay and prevent it from becoming complicated. When we talk about reversing diabetes, there's been a lot of newer studies showing that lifestyle measures, those lifestyle measures that I'm always talking about, actually are the ones that will help to reverse diabetes and actually can reverse diabetes. So while the scope of this program, while it's outside of the scope of this program to go into detail exactly about those lifestyle measures and how they affect the reversal of diabetes, I want to encourage you to talk to your doctor about how healthy plant-based foods diet and regular exercise can work intricately in your body to reverse that metabolic imbalance that's going on and improve your insulin sensitivity and improve those blood glucose levels and overall cure or really get rid of the diabetes. Now, like I said, it's a very personalized recommendation on what you should do and how you should do it. But I do want to encourage you to look into it because I think, and I've seen, it is possible. All right, let's get to the next question. This one comes to us from Michael, and he reaches out to us through YouTube asking, my mother-in-law has been a diabetic. Lately, her sugar has dropped unexpectedly often, and she has even passed out. Her friend had to call the paramedics. She is coming over on Sunday. Is there anything we should have on hand in case it happens? She said just to have candy and juice in the house. What do you think? Firstly, I hope she's okay. And it's very possible that episodes like this can happen with diabetic patients, especially if they're on certain medications that can predispose the sugars to lowering, and sometimes they can lower too much. Furthermore, the chances of hypoglycemic episodes or episodes of really low sugar can happen and are more likely to happen in individuals who are of an older age, especially 65 and older. So it's really important to be vigilant of this, just like you and your family are being, and to know what to do in certain situations. Now, there's different levels of hypoglycemia in diabetics, and each of them has its own recommendation on exactly how to treat it. But generally, it's advised to have a carbohydrate-rich item, food or drink nearby should an individual's blood glucose sugar drop below 70, and then definitely below 60, especially if they're having symptoms and especially if they're elderly. Some of these items include candy and juice, but even glucose tablets are good to have on hand. And with glucose tablets, we know a little bit more precisely exactly how many carbohydrates and sugars are in them. So it might be a little bit of a better way to go. But certainly talk to her doctor to see what is most appropriate for her. Sometimes it's even necessary to have a small meal to get your sugars back up. So not just juice or candy, but actually maybe a sandwich or something else that's healthy. Of course, if the level of hypoglycemia is severe, so heaven forbid her sugars drop into the 30s or 40s, anything lower than that is honestly incompatible with life. It's an emergency, it's a medical emergency, and you want to either call 911 or you want to get her to the nearest emergency room for appropriate treatment ASAP. Remember, the other thing is if she's having a lot of these episodes, we want to know why, because you want to get to the root of the problem so you can treat it most appropriately. So is she having these low sugar episodes or hypoglycemic episodes because maybe she's on too much medication? Maybe there's something else going on in the body that's causing this to happen. So either way, you really want to look into that so you get to the root of it so you can prevent these episodes from happening and other things from happening. For instance, if she has low sugar, she gets dizzy and she passes out, she may even fall and break a bone or break a hip, which can be quite detrimental. So you want to make sure that you want to prevent all that altogether. All right, let's get to our next question that comes to us from Arthur. And Arthur reaches out through Facebook asking, my daughter-in-law is 6 months pregnant and was diagnosed with gestational diabetes. What exactly is that? And is it dangerous for her or the baby? Hi, Arthur. Firstly, congratulations to you and your family. I hope she has a very smooth, uncomplicated, and happy pregnancy. Now, contrary to what many people think, gestational diabetes is a bit different from regular diabetes. When a woman is pregnant, believe it or not, her body naturally produces a higher amount of certain hormones, and these hormones may actually promote insulin resistance. But normally, most women can handle it. Their bodies can handle it. In a percentage of women, their bodies have an underlying mechanism that either puts them at risk for prediabetes or they already had prediabetes. Either way, their hormonal system is not able to handle this influx of other hormones that comes in when they're pregnant. And although that's a very oversimplified explanation, this is one of the main causes of why that particular woman may develop gestational diabetes. Now, it may be because their pancreatic function is reduced while they're pregnant and isn't able to overcome that influx of hormones, or it might be that they were insulin resistant to begin with. The reason why it happens is important, but what's more important is the fact that it happened and how to manage it appropriately once a woman is diagnosed with gestational diabetes. Now, although gestational diabetes may pose other health risks, studies have actually not shown an increased risk of congenital anomalies to the baby. So that's very reassuring, and I hope that helps alleviate some of your concerns as well. Now, that happens in women who didn't have diabetes prior to her pregnancy. In women who had diabetes prior to the pregnancy and prior to being diagnosed with gestational diabetes, that's a whole different story, and that requires a lot of on-site and a lot of oversight and monitoring by the obstetrician. Now, some of the health risks that a woman and her baby can have due to gestational diabetes is the baby might be born at a larger size. That in itself can produce a lot of complications during birth. There's also a small risk of stillbirth. Now, that being said, it's very, very important that when a woman has gestational diabetes, that she checks in regularly with her obstetrician and she's managing it as best as she can, and that optimizes her chances of a healthy pregnancy. All right, folks. Well, it's been wonderful answering these questions today, and thank you for sending them in. They've been great. I hope it's helped you learn a little bit more about diabetes. I'll see you next time here on Ask the Doc. No appointment needed.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.